Agoraphobia is often misunderstood as simply a fear of open spaces, but it's actually far more complex and profound. It's an anxiety disorder that causes people to fear and avoid places or situations that might make them feel trapped, helpless, or embarrassed. For those who experience it, everyday activities that many take for granted, like shopping, using public transportation, or even leaving home, can become overwhelming challenges. Today, we'll explore what agoraphobia truly is, how it affects people's lives, and the pathways that lead to recovery and renewed freedom. What is agoraphobia? Agoraphobia is characterized by intense fear and anxiety triggered by real or anticipated exposure to situations where escape might be difficult or help might not be available if panic symptoms occur. It's classified as an anxiety disorder in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. People with agoraphobia typically fear two or more of the following situations: using public transportation, buses, trains, planes; being in open spaces, parking lots, bridges, markets; being in enclosed places, shops, theaters, elevators; standing in line, or being in crowds; being outside the home alone. What makes agoraphobia particularly challenging is that these fears can lead to a severely restricted lifestyle. In severe cases, people become completely housebound, unable to venture beyond the perceived safety of their home environment. Approximately 1 to 2% of adults experience agoraphobia at some point in their lives, with symptoms typically emerging in late adolescence or early adulthood. Without treatment, agoraphobia can become chronic and significantly impair quality of life. The experience of agoraphobia. To understand agoraphobia, we must recognize that it's more than just fear. It's a complex emotional and physical experience. People with agoraphobia often describe feeling intense fear or panic when confronted with feared situations, persistent worry about experiencing a panic attack in places where escape would be difficult, overwhelming dread about being embarrassed or helpless in public, a sense that the world has become unsafe and unpredictable, frustration and sadness about lost independence and opportunities. These emotional experiences are typically accompanied by physical symptoms like racing heartbeat, difficulty breathing or hyperventilation, dizziness or lightheadedness, sweating or chills, chest pain or discomfort, nausea or stomach distress, trembling or shaking. For many, the anticipation of these symptoms can be just as debilitating as the symptoms themselves, creating a cycle of fear and avoidance that grows increasingly restrictive over time. The development of agoraphobia. Agoraphobia typically develops through a combination of biological, psychological, and environmental factors. Biological factors include genetic predisposition to anxiety disorders, imbalances in brain chemicals that regulate stress and anxiety, a heightened sensitivity to bodily sensations. Psychological factors include a tendency toward catastrophic thinking about physical sensations, low tolerance for uncertainty or discomfort, traumatic experiences in public places, learned associations between certain situations and panic. Environmental factors include family modeling of anxious behaviors, stressful life events or transitions, experiences of being unable to escape a frightening situation. Most commonly, agoraphobia develops after a person experiences an unexpected panic attack in a public setting. The person then becomes afraid of having another panic attack and begins avoiding situations similar to where the original attack occurred. Over time, this avoidance behavior can generalize to more and more situations. Agoraphobia versus panic disorder. While agoraphobia often coexists with panic disorder, they are distinct conditions. Panic disorder is characterized by recurrent, unexpected panic attacks and persistent worry about having additional attacks. Agoraphobia specifically involves fear and avoidance of situations where escape might be difficult if panic symptoms occur. Not everyone with panic disorder develops agoraphobia, and not everyone with agoraphobia experiences full panic attacks. Some may experience limited symptom attacks or general anxiety in feared situations. The relationship between these conditions is complex. About 1/3 of people with panic disorder also develop agoraphobia. Some people develop agoraphobia without Understanding this distinction is important for proper diagnosis and effective treatment planning. Impact on daily life. The impact of agoraphobia on daily life can be profound and far-reaching. Social consequences asterisk. Isolation from friends and family. Difficulty maintaining relationships. Inability to participate in social gatherings or important events. Occupational impacts asterisk. Limitations on career choices. Difficulty commuting to work. Challenges with work-related travel or meetings. Health implications asterisk. Avoidance of medical appointments. Increased risk of developing other mental health conditions. Physical deconditioning from limited activity. Financial strains asterisk. Potential loss of income. Costs associated with specialized transportation. Treatment expenses. Many people with agoraphobia develop creative workarounds to maintain some semblance of normalcy, shopping online instead of in stores, working remotely, or relying heavily on trusted companions when venturing out. While these adaptations can help in the short term, they often reinforce the underlying anxiety pattern. Diagnosis and assessment. Diagnosing agoraphobia involves a comprehensive evaluation by a mental health professional, typically including a detailed clinical interview about symptoms, their onset and impact, assessment of feared and avoided situations, ruling out medical conditions that might mimic anxiety symptoms, evaluating for co-occurring conditions like depression or other anxiety disorders, determining the severity of impairment in daily functioning. According to diagnostic criteria, the fear or anxiety must be out of proportion to the actual danger posed by the situations, cause significant distress or impairment, and persist for 6 months or more. Early diagnosis is beneficial, as treatment outcomes tend to be better when intervention occurs before avoidance patterns become deeply entrenched. If you recognize these symptoms in yourself or someone you care about, seeking professional assessment is an important first step. Treatment approaches. The good news is that agoraphobia is highly treatable with proper intervention. Several effective approaches include cognitive behavioral therapy (CBT). The most effective treatment for agoraphobia includes cognitive restructuring to address unhelpful thoughts, employs gradual exposure to feared situations, systematic desensitization, teaches skills for managing anxiety and panic symptoms, typically shows significant results within 12 to 20 sessions. Medication asterisk. Antidepressants, particularly SSRIs like sertraline or escitalopram. Anti-anxiety medications, used cautiously due to dependence risks, can help reduce symptoms enough to make therapy more effective. Complementary approaches asterisk. Relaxation techniques and breathing exercises. Mindfulness meditation. Regular physical exercise. Stress management strategies. Many people benefit from a combination of therapy and medication, particularly in more severe cases. Treatment is typically collaborative, with the individual and therapist working together to establish goals and gradually build confidence in navigating previously feared situations. Self-help strategies. While professional treatment is important, there are many valuable self-help strategies that can support recovery. Education asterisk learning about anxiety, panic, and agoraphobia helps normalize the experience and reduce fear of the symptoms themselves. Gradual exposure asterisk creating a hierarchy of feared situations and gradually working through them, starting with the least anxiety-provoking. Breathing and relaxation asterisk practicing diaphragmatic breathing and progressive muscle relaxation to manage physical symptoms. Mindfulness asterisk learning to observe anxious thoughts and sensations without judgment or reaction. Support systems asterisk enlisting understanding friends or family members who can accompany you during exposure exercises. Lifestyle factors asterisk limiting caffeine and alcohol, maintaining regular sleep patterns, and engaging in regular physical activity. Celebrating progress asterisk acknowledging and rewarding even small steps forward in recovery. Support groups, whether in person or online, can also provide valuable encouragement from others who truly understand the challenges of living with and recovering from agoraphobia. Recovery and hope. Recovery from agoraphobia is not about eliminating all anxiety. It's about reclaiming freedom and choice in your life despite occasional discomfort. With effective treatment and practice, what once seemed impossible often becomes manageable and eventually even comfortable. The journey to recovery typically involves learning to tolerate and accept anxious feelings rather than fighting them, gradually expanding your comfort zone at a pace that feels challenging but not overwhelming, replacing avoidance with approach behaviors, building confidence through successful experiences, developing a toolbox of coping strategies for different situations. Recovery looks different for everyone. For some, it means being able to travel independently again. For others, it might mean simply being able to go grocery shopping without assistance. Each person sets their own meaningful goals based on what matters most in their life. Remember that setbacks are a normal part of the recovery process. Having a difficult day doesn't erase your progress or mean that you're back at square one. With persistence and support, agoraphobia can be overcome, opening the door to a life defined by possibility rather than limitation. If you're struggling with agoraphobia, know that you're not alone and effective help is available. The journey to recovery begins with reaching out to a mental health professional, a supportive loved one, or even an online community of people who understand. Taking that first step, however small it may seem, is the beginning of reclaiming your freedom.